100 CNA practice exam questions with answers. Full review. Question 1. You are caring for Luis, a resident admitted to the hospital for pneumonia. He tells you that he is positive for HIV. This was not a part of the report you received from the nurse. You should: Option A. Check his medical chart for information. Option B. Report Luis's statement to the nurse. Option C. Ask his family if this new information is correct. Option D. Tell your co-workers to wear gloves and isolation gowns when entering the room. The correct answer is option B. Report Luis's statement to the nurse. Report Luis's statement to the nurse. Question 2. In Maslow's hierarchy of needs, the level that addresses the social, creative, emotional, and spiritual potential within a person is: Option A. Self-actualization. Option B. Esteem. Option C. Love and belonging. Option D. Physiological. The correct answer is option A. Self-actualization. Self-actualization. Question 3. Signs and symptoms of an anaphylactic reaction include: Option A. Bleeding and confusion. Option B. An unsafe rise in blood pressure and pulse. Option C. Shock, shortness of breath, wheezing, and facial and airway swelling. Option D. Dizziness, lack of appetite, and nausea. The correct answer is option C. Shock, shortness of breath, wheezing, and facial and airway swelling. Shock, shortness of breath, wheezing, and facial and airway swelling. Question 4. Assisting the resident with range of motion exercises can help: Option A. Prevent contractures. Option B. Improve comfort. Option C. Reduce the risk of atrophy. Option D. Do all of the above. The correct answer is option D. Do all of the above. Do all of the above. Question 5. You can assist the independent resident with exercise or ambulation by: Option A. Using verbal encouragement. Option B. Being close during ambulation. Option C. Using a gait belt during ambulation and movement. Option D. Doing nothing. You do not need to assist an independent resident. The correct answer is option A. Using verbal encouragement. Using verbal encouragement. Question 6. You are performing range of motion exercises for a resident who has a weakened right arm and leg. One of the required movements on the resident's care plan is abduction. This means: Option A. Increasing the joint angle. Option B. Moving away from the midline of the body. Option C. Moving toward the midline of the body. Option D. Moving the foot so that the toes are pointing downward. The correct answer is option B. Moving away from the midline of the body. Moving away from the midline of the body. Question 7. The first step in a resident's physical therapy is: Option A. An evaluation by the nurse. Option B. The therapist determines the resident's goals. Option C. An evaluation by the physical therapist. Option D. The therapist designs a plan of care. The correct answer is option C. An evaluation by the physical therapist. An evaluation by the physical therapist. Question 8. The physical therapist works mostly on: Option A. Swallowing difficulties. Option B. Restorative efforts. Option C. Fine motor skills. Option D. Gross motor skills. The correct answer is option D. Gross motor skills. Gross motor skills. Question 9. The person responsible for maintaining a resident's level of ability through range of motion exercises is the: Option A. Occupational therapist. Option B. Nursing assistant. Option C. Licensed practical nurse. Option D. Respiratory therapist. The correct answer is option B. Nursing assistant. Nursing assistant. Question 10. You notice that one of your residents is having difficulties at mealtime. She has trouble swallowing her fluids and coughs with each bite. The person who could best help her would be the: Option A. Occupational therapist. Option B. Restorative aid. Option C. Speech-language pathologist. Option D. Physical therapist. The correct answer is option C. Speech-language pathologist. Speech-language pathologist. Question 11. Gail is an older resident who uses a wheelchair to move about the facility. You encourage her to ambulate with you, but she often refuses. You should. Option A. Encourage her to walk in her room. Option B. Inform the nurse that Gail no longer walks. Option C. Tell Gail that she needs to ambulate at least twice a day. Option D. Refer her to the physical therapist. The correct answer is option A. Encourage her to walk in her room. Encourage her to walk in her room. Question 12. Assisting a resident with ambulation can decrease the resident's risk of Option A. Constipation. Option B. Arthritis. Option C. Diarrhea. Option D. Nausea. The correct answer is option A. Constipation. Constipation. Question 13. An intervention often used to relieve the pain and swelling associated with acute injuries is Option A. An ice pack. Option B. The topical ointment. Option C. Ambulation. Option D. Exercise. The correct answer is option A. An ice pack. An ice pack. Question 14. Properly sized crutches should have a space between the resident's underarms and the crutch that measure Option A. 0 inches. Option B. 1 inch. Option C. 2 inches. Option D. 3 inches. The correct answer is option C. 2 inches. 2 inches. Question 15. The nursing assistant should lock the resident's wheelchair when she is Option A. Ambulating the resident down the hallway. Option B. Assisting the resident with a quad cane. Option C. Transferring the resident from the bed to a wheelchair. Option D. Placing the resident at the dining room table. The correct answer is option C. Transferring the resident from the bed to a wheelchair. Transferring the resident from the bed to a wheelchair. Question 16. John is a 50-year-old resident who is working on ambulation and fine motor control in his hands following a motorcycle accident. Those involved in his therapy might include Option A. An occupational therapist. Option B. His wife and children. Option C. The physical therapist. Option D. Both A and C. The correct answer is option D. Both A and C. Both A and C. Question 17. Exercise and ambulation are essential to the residents. Option A. Self-esteem. Option B. Musculoskeletal health. Option C. Digestive health. Option D. All of the above. The correct answer is option D. All of the above. All of the above. Question 18. Your resident has Parkinson's disease and is quite shaky at mealtimes. The best device to help the resident maintain independence during meals is Option A. A cup with handles. Option B. A cup with a lid and handles. Option C. A nosy cup. Option D. A regular coffee cup. The correct answer is option B. A cup with a lid and handles. A cup with a lid and handles. Question 19. A nosy cup is used for the resident who Option A. Cannot tilt his head back to drink. Option B. Has a hand tremor. Option C. Does not have good wrist flexion. Option D. Cannot open his mouth adequately. The correct answer is option A. Cannot tilt his head back to drink. Cannot tilt his head back to drink. Question 20. Your resident uses a hand splint. When you take the splint off to clean it, you see a small crack in the splint where the index finger rests against it. The best response is to Option A. Take the splint to the nurse for repair. Option B. Place soft cloths between the splint and the skin. Option C. Put a small amount of glue in the crack. Option D. Wash the splint with mild soap and water. The correct answer is option A. Take the splint to the nurse for repair. Take the splint to the nurse for repair. Question 21. Tay recently had a hip replacement. His doctor told him that he cannot bend at the hip greater than 90 degrees. An adaptive tool that would help him to care for himself at home would be Option A. A shoehorn. Option B. Elastic shoelaces. Option C. A long-handled bath sponge. Option D. All of the above. The correct answer is option D. All of the above. All of the above. Question 22. IADL activities might include learning how to Option A. Walk with a prosthetic leg. Option B. Cook supper with a broken arm. Option C, wash yourself following a stroke. Option D, climb stairs safely. The correct answer is option B, cook supper with a broken arm. Cook supper with a broken arm. Question 23. You are walking with Mrs. Stewart when she begins limping and grimacing in pain. She refuses to walk any further and states that she thinks she hurt her foot this morning. The subjective data to report to the nurse is that Mrs. Stewart, option A, is experiencing foot pain. Option B stated that she hurt herself. Option C is refusing to walk. Option D was limping during her walk. The correct answer is option A, is experiencing foot pain. Is experiencing foot pain. Question 24. The abbreviation for the phrase as needed is option A, WN, option B, PRN, option C, PN, option D, ASN. The correct answer is option B, PRN. PRN. Question 25. A visitor to your facility becomes angry and starts yelling, using foul language, and upsetting the residents. After making sure that you and your residents are safe, you should fill out a N. Option A, disturbance document. Option B, accident report. Option C, accident recording sheet. Option D, incident report. The correct answer is option D, incident report. Incident report. Question 26. The commonly used abbreviation for nothing by mouth is option A, NBM, option B, NPM, option C, NPO, option D, OBM. The correct answer is option C, NPO. NPO. Question 27. Resident information that needs to be documented includes option A, urinary output, option B, refusing activities, option C, signs of depression, option D, all of the above. The correct answer is option D, all of the above. All of the above. Question 28. The term 4 times a day is commonly abbreviated as option A, QID, option B, QHS, option C, 4D, option D, QOD. The correct answer is option A, QID. QID. Question 29. Thinking you know a resident's food preferences is an example of being option A, subjective, option B, factual, option C, unbiased, option D, objective. The correct answer is option A, subjective. Subjective. Question 30. The term proximal means option A, toward the front side of the body, option B, the side of the body, option C, away from the midline of the body, option D, the nearer of 2 points on the body. The correct answer is option D, the nearer of 2 points on the body. The nearer of 2 points on the body. Question 31. Mottling is most likely to appear on the residents. Option A, chest, option B, abdomen, option C, legs and feet, option D, face. The correct answer is option C, legs and feet. Legs and feet. Question 32. Nervous system changes that take place during the dying process include all of the following except option A, twitching movements, option B, decreased alertness, option C, hallucinations, option D, loss of hearing. The correct answer is option D, loss of hearing. Loss of hearing. Question 33. You are assisting with post-mortem care, you must follow option A, medical asepsis and surgical ASPs, option B, sterile technique and isolation precautions, option C, standard precautions and the bloodborne pathogen standard, option D, the care plan. The correct answer is option C, standard precautions and the bloodborne pathogen standard. Standard precautions and the bloodborne pathogen standard. Question 34. Post-mortem care is done to option A, prevent rigor mortis, option B, prevent the skin from changing color, option C, maintain a good appearance of the body, option D, clean the body. The correct answer is option C, maintain a good appearance of the body. Maintain a good appearance of the body. Question 35. You have noticed that your resident has been breathing very rapidly and shallowly, followed by slow, deep breaths. The resident is showing signs of Option A, a molting. Option B, the death rattle. Option C, Cheyne-Stokes breathing. Option D, low blood pressure. The correct answer is option C, Cheyne-Stokes breathing. Cheyne-Stokes breathing. Question 36. An advance directive is Option A, of the care plan. Option B, an order not to resuscitate the person. Option C, the document stating a person's wishes about healthcare when that person cannot make such decisions. Option D, the document stating the person's wishes about life support measures. The correct answer is option C, a document stating a person's wishes about healthcare when that person cannot make such decisions. A document stating a person's wishes about healthcare when that person cannot make such decisions. Question 37. You are caring for a resident who is in the last stages of dying. Today, when you speak to him, he doesn't respond. You should. Option A, continue to talk to him in a normal tone of voice. Option B, raise your voice until he responds to you. Option C, call the family to update them of this change. Option D, take out his hearing aids and give them to his family. The correct answer is option A, continue to talk to him in a normal tone of voice. Continue to talk to him in a normal tone of voice. Question 38. After a resident dies, the nurse's responsibilities include Option A, listening for a heartbeat and updating the doctor. Option B, pronouncing the time of death. Option C, asking the family to call their funeral director. Option D, tidying up the resident's room. The correct answer is option A, listening for a heartbeat and updating the doctor. Listening for a heartbeat and updating the doctor. Question 39. According to Dr. Elizabeth Kubler-Ross, the 5 stages of dying are Option A, denial, pain, sadness, bargaining, and acceptance. Option B, denial, pain, acceptance, hospice, and death. Option C, denial, anger, bargaining, depression, and acceptance. Option D, denial, anger, sadness, hospice, and acceptance. The correct answer is option C, denial, anger, bargaining, depression, and acceptance. Denial, anger, bargaining, depression, and acceptance. Question 40. You are caring for Dorian, a 58-year-old resident who is dying of prostate cancer. Today, when you are assisting Dorian with his breakfast, he coughs with each bite and shakes his head. You should. Option A, continue to offer him his breakfast. Option B, stop, ensure that he is safe, and then update the nurse. Option C, give him only his fluids until he is on longer coughing. Option D, tell him that he won't feel better unless he eats something. The correct answer is option B, stop, ensure that he is safe, and then update the nurse. Stop, ensure that he is safe, and then update the nurse. Question 41. The nursing assistant should provide oral care for a resident who is dying. Option A, each time you reposition her. Option B, 2 or 3 times a day. Option C, every 15 minutes. Option D, only when the resident requests. The correct answer is option A, each time you reposition her. Each time you reposition her. Question 42. Edna is a resident who is dying of a respiratory disease. She tells you that she is Catholic and would like to have a priest come visit her. The appropriate action to take is to Option A, call the family and ask them to contact Edna's church. Option B, look in Edna's chart for more information. Option C, tell your facility's social worker right away. Option D, update the nurse with Edna's request. The correct answer is option D, update the nurse with Edna's request. Update the nurse with Edna's request. Question 43. You are caring for Faith, a resident who is dying of kidney failure. Her family has been keeping a vigil at the bedside. Tonight, they seem especially upset and start shouting at each other while still in Faith's room. After making sure Faith is safe, the first thing you should do is Option A, ask the family members to leave the facility. Option B, dial 911 and report the emergency. Option C, immediately report the nurse for directives. Option D, ask the nurse if a counselor is available. The correct answer is option C. Immediately report the nurse for directives. Immediately report the nurse for directives.